The idea is shared care for guys with prostate cancer. And it means that people with prostate cancer aren't being dragged back into secondary care every 3 or 6 months, but can be followed up out in primary care. And it can be done safely because of the way we've built in the pathways and the protocols. They've got very quick access back into secondary care, should they need it, by somebody picking up a phone. And they don't really need to lose contact with the urology nurses who were the key workers, because if they have got a problem, even though they're in primary care, they can pick up the phone and speak to us as well.
What we're actually doing is looking at a symptom in the clinic rather than the usual conventional way that clinics tend to run, where they tend to focus on ologies and different conditions. In this clinic, we're actually focusing on the symptom of fatigue. And people get sent to the clinic from a whole range of different medical conditions, but the one unifying thing is that they're fatigued. And we use a range of different strategies to look for reversible reasons why they may be fatigued, so that we can help make them feel better. But also the team help people manage their symptom so that they can perhaps live their life better with the symptom if we can't get rid of it.
The bright idea was to look at a solution to the problem, which was when people were ready to leave Walkergate, when their rehab potential was met in terms of the specialist service, there wasn't always a place for them to go to continue that journey. There wasn't always specialist nursing homes who could manage their complex needs. So that meant that they either went to an inappropriate placement or they stayed at Walkergate Park longer than necessary, which meant that people who were waiting to come in couldn't come in.
But through collaborating together by training, upskilling, and now with the NHS staff actually working in the independent sector with us collectively, we're providing an integrated service to provide the best possible service for patients.
Our bright idea is a two-pronged approach. So one of that is a support group for children, young people and families living with type 1 diabetes. That's called Type 1 Kids. And the other prong is a telehealth Florence system, which we create motivational and clinical text messaging pathways for young people.